Hello, everyone. I am Dr. Muriel Diano, and I will be talking about gamification in dental education beyond lectures. First and foremost, I would like to thank uh, Cebu Doctors University College of Dentistry for giving me the opportunity to be one of the speakers or the lecturers for the first ever annual research congress. So it's such an honor. Thank you very much. I have been a faculty of Cebu Doctors University College of Dentistry under the Department of Operative Dentistry, and I am an associate member of the Medical Sciences Division of the National Research Council of the Philippines. Our learning objectives for today is to critique traditional lectures' limits for clinical skills and to explain gamification's benefits like better engagement, better retention, and uncertainty simulation. Our lecture flow for today will include traditional methods gaps, gamification basics, evidence-based benefits, and the core case study, which is exploring the use of scenario-based choose-your-own-adventure games for restorative dentistry. Next would be applications and implementation, and last but not the least is challenges and activity. For traditional lectures limits, one limit would always be passive learning issues. So lectures just give out facts. It is always the instructor or it is always the lecturer or the teacher who gives the students the knowledge that they need for a certain subject. But the thing is, students are just passive learners. So that is going to be a big hurdle for everyone, not only for the teacher, so that we will be able to know if the students really learned something. So sometimes they will not be able to give reasoning because they are uncertain about their answers. And there is also low retention in clinical dentistry, for example, in endodontics. I am mentioning endodontics in the study because there are actually a lot of gamification studies, which includes endodontics. So it is discussed by Lee et al. In their study emerging trends in gamification for clinical reasoning education, a scoping review, and they suggested that gamification enhances learning engagement and motivation, both of which are essentially not only for initiating learning, but also for ensuring knowledge retention in healthcare education. So as teachers, it is always our goal to make sure that learning doesn't stop within the four walls of the classroom. As much as possible, whatever the students will learn they should be able to practice it outside, especially in dentistry, since we are dealing with live people. Okay, so whatever they learn during the lecture, they should be able to transfer it when they do their clinical works later on. Another problem is clinical reasoning gap. Dentistry demands decisions with patient variability. This is a fact that not all patients will have the same case as another patient. So they might have the same diagnosis, but the way you treat them later on there's going to be variability in how you're going to treat them. In fact, Matthew et al. In their study titled "Designing Gamified Branching Scenarios on a Technological Platform to Enhance Clinical Reasoning in Dental Education," published in Scholarship of Technology Enhanced Learning, said that traditional methods may offer limited opportunities to experience decision consequences without risking patient harm. This is actually very interesting because as dentists, we know that if we commit a mistake inside our patient's mouth, sometimes the mistake becomes irreversible. So this is also the reason why most clinicians stop doing. Okay, it's not really stop, but they get a pause when they try to work in their clinical in their clinical works because they committed a mistake and they know that it is irreversible, they got reprimanded and all of those things. But if we are going to gamify branching scenarios when it comes to certain cases, and then they will be able to give uh, the clinicians opportunities to treat that certain case, and then they are not going to fear that they are going to harm a patient, because you can never harm um let's say a gamified character or a gamified scene or a gamified patient. Okay, so that gives them confidence later on to work because they already know the basics and what could happen if they see that certain case. Traditional formats also lack feedback loops. This is also a thing that has been constantly repeated with researchers when it comes to education, that feedback is a very important thing. In fact, it has been explained that immediate feedback is one of the best ways to help students retain information better. So, according to a study in the International Journal of Serious Games entitled "Elements Explaining Learning Clinical Reasoning Using Simulation Games," they said that feedback can be corrective. When learners are told if their answers are right or wrong or explanatory, the game actually provides the right and wrong answers together with the explanations. So if they get an answer correctly, then the students will be able to better retain the information because they're going to say, oh, I got this right. And this was the explanation. And then maybe on the next question, they got it wrong. Then sometimes most of the games will tell them you got it wrong or incorrect, but they will lead you to another part of the game wherein you may go back to the start of the game, or there will be another branching consequence when it comes to the choice that the student made. And of course, for that, the students will remember that I got this wrong. Maybe the answer should be the other one. And then that correct answer will be explained better when after they got the correct answer. Gamification defined. So what is gamification? So to call something a gamified learning or gamification, it should have game elements, like it should have points, it should have badges, it should have scenarios when it comes to education. And a study by the same study by Lee et al., Emerging Trends in Gamification for Clinical Reasoning Education, a scoping review, they found out that gamification has emerged as a developing paradigm in education, integrating game design, game elements, and educational strategies to enhance learners' motivation and performance. Let's face it, students right now are looking for more interactive ways to learn, and they are more into short term lecture based. Their attention span unfortunately is not that good, so they cannot uh they cannot what do you call this, they cannot sit for long lectures. Okay, so if we include gamification in our lectures, this can really help the shift the students' focus into what really matters when it comes to a certain subject or certain content that we want our students to learn. So enable for us to make sure that we do gamification, you should be able to design a game. It doesn't matter how complicated or how simple it is. There should be game elements, and you should be able to place your strategies in relation to whatever you want your students to learn, and what is the end performance that you want to see from the students. It also shifts to active and immersive learning because, as I've mentioned before, traditional lectures is just one way. It's very passive. It's just a teacher talking to the students, and sometimes the students are not really in the zone or they're not really listening to the teacher. So, in a study under current issues in health professions education, entitled Gamification Strategies for Enhanced Student Engagement in Dental Education, more specifically, gamification in education concepts and applications, they mentioned that integration of game elements such as points, badges, even leaderboards, and you give certain challenges. So in a certain part of a game, maybe you can give a certain challenge to give them more points. And then if they got it correctly, then they can get higher into the leaderboard. That really motivates students, okay, into educational activities to create interactive and immersive learning experiences. The core elements of gamified learning, or in this case, create your own adventure games, are the branching choices for decisions. So you are given one scenario, a student is given a scenario, and then there are branching choices that they can, branching choices that, or different choices that they are going to choose from. And each branch contains a certain consequence. It could be the right answer leading you to the next part of the scenario, or it could be wrong answer, giving you a bad consequence, and then it may lead you to the start of the game, or it may lead you to a part of the game where it will tell you that basically the treatment has failed. So that could be that could be done when it comes to gamification. And I also mentioned that immediate feedback is very necessary. So feedback and rewards are very important when it comes to retention. As I've mentioned, when students get the correct answer, or when participants get the correct answer, they usually get immediate feedback telling them, you got it right, congratulations. These small things are actually a very big deal to students, especially nowadays. Okay, and you can actually call them as a reward, and those things matter to them, and it helps with the retention. Why dentistry? Why did I choose create your own adventure games focusing on dentistry? So as I've mentioned before, it can actually help us in simulating irreversible procedures safely. So there is no fear that we are going to harm a patient or do irreversible damage on a certain patient because they are doing it on a simulation. Proven benefits. It can boost engagement. In fact, 56.6% rated very engaging in endodontics. There is a study in endodontics that tested for technology acceptance, and they found out that students who took the game or who played the game found the game very engaging and actually very helpful for them. So that is very good as long as students are very much engaged with your game and you also incorporate it in your lectures, then that is a win-win situation for both the teachers and the students. It also improves retention. In fact, after adding gamification in as part of their lectures, there is 25 to 30% gains when they have quizzes. So that is a very big gain. Again, this is a win-win for both teachers and students. And then students will be able to handle uncertainty because again, in our games, we try to mimic scenarios of real cases. So students will be able to picture out that this is the case, this is what we're going to do, this is the problem of the patient, this is the history of the patient, this is how the tooth looks like, and how are you going to, let's say, how are you going to access this? is this the correct way to access this, or is this the correct way to access this? In fact, for this picture, this is a VR simulation for accessing access outlines for endo. So as you can see in this portion here, there you can see a circle on the lingual surface of the canine. So it actually, on the other side, it also gives you another outline form for the access. So the students are going to choose via VR. And then meta evidence, it has been found out that games outperform lectures. Yes, this is true, but in the case of dentistry, lectures is still needed. This is what I'm trying to say, that lectures are still needed, but it will always be better. It will always be better to incorporate games, because games by itself doesn't really give all the students all the basic information. They just give them the simulation and they decide based on what was lectured beforehand. So although there is research saying that games outperform lectures in dentistry, I would still say that lectures should go hand in hand with games. The core case study is, again, exploring the use of scenario-based choose-your-own-adventure games for dentistry. It has been published on February 7, 2024, and received and accepted March 17, 2024 in the American Dental Education Association under the Journal of Dental Education. So in this study, we made a create your own adventure game using PowerPoint hyperlinks. Again, for a certain scenario, there are different choices, and each choices will have their own consequence, and each consequence will branch out to other scenarios, and each scenario will again have different choices and branch out again to different consequences. The Create Your Own Adventure game format has been used in various health professions in the education fields. So what we did here is that we made a 25-item pre-test post-test questionnaire given to fourth-year dental students. We used a sample of 155 students to measure knowledge acquisition, while a survey was done to gather information regarding the demographic profile. And it has been found out that students predominantly came from the STEM strand, with smaller proportions from other academic strands. Personality-wise, type B personalities were prevalent compared to type A personalities. So this for the type A personalities, they're actually the very OC. They exhibit higher levels of competitiveness. They have time urgency, and they are prone to stress. While type B personalities are more relaxed, more laid back, and less prone to stress when it comes to academic settings. And it has also been found out that students have an average of almost 10 years of computer experience, for the reason that it has already been added in the Philippine curriculum that students learn computer at an early age. In fact, I think in elementary it is already mandatory that schools teach computers. So they have been exposed to computers early on in their life. That's why we call these students digital natives. Okay, so technology has been born with them. Technology has grown with them. Okay, and else. Okay, so again, I mentioned that we had fourth year students tested for branching games, and this is the timeline of my study. Day 0 was the create your own adventure game development, wherein the choose your own adventure game was developed specifically for restorative dentistry. I think this is the first study that focused on create your own adventure games, focusing on restorative dentistry. It simulates realistic clinical scenarios or for decision making, and it provides immediate feedback and instructional content to reinforce learning objectives. For day 1, it is the orientation of the study participants. The participants were oriented on the study objectives, the scope, and their confidentiality. Online questionnaires were distributed through the learner management system. On day 2, they were given the pretest, and it was administered on site, face to face. And then intervention was done on days 3 to 179. So the serious game was utilized in restorative dentistry class because as I have mentioned, it is always better to combine lectures and gamification. Again, this is to enhance or increase retention for knowledge that we want our students to learn. It is designed to be engaging and interactive, and immediate feedback is provided on the performance and their progress in the game. It is on day 180 that I gave them the post. The post test was given. It is similar to the pre-test administered on site, and the results were shared with the participants if they want to know their results. And then on day 181 is the data analysis, where the mean, the standard deviation, the frequency count, and the percentages used were calculated. The Kruskal-Wallis H test with Don's multiple comparison post hoc for technology acceptance was used as well. And then for personality types and pre-test, post-test scores, the Mann-Whitney U test was used. And to check for significant relationships, the binomial logistic regression was used. Key findings in the study is that there are better outcomes despite technology hurdles. So in the Philippines, we cannot deny the fact that we are still lagging when it comes to technology. I mean, not all of us has access to better technology. Not all of us has access to good internet connections. But despite all of those problems, we got better outcomes. We got really good outcomes. And we also found out that the science technology backgrounds or the STEM strand excelled when it came to the pre-test, post-test studies, questionnaires, results. So the implications, it replicates clinical variability. So figure 3 shows the results. So figure 3.A shows us the pre-test, post-test results. So this shows to us that during the pre-test, the students actually got scores lower than the passing percentage, which is 75%. But after the intervention, after giving the intervention and giving the post-test, there is a significant increase in post-test scores. So that is a really good result. And then figure 3B shows us the pre-test, the senior high school strand and the pre-test results. This actually shows us that some of the STEM students scored higher. But if you look at this table, or if you look at this chart, if you look at this chart closely, you will find that there is no statistical significance between the results. And then figure 3C shows the different senior high school strands and their post-test results. And this clearly shows that for the STEM strand, they really did well as compared to the other senior high school strands like ABM, GAS, and HES. Dental applications. So restorative examples. So this is the game that was made. So create your own adventure game for treatment choices. And this is what I mentioned. There are branching choices. There is a case given. There are questions for a certain scenario. and then you are given the students are given choices, and each choice will give out different consequences. If they answered correctly, if they answered correctly, they will be given immediate feedback, like they're going to be given praise, correct, and then the feedback will immediately be what is the reasoning on why your answer is correct. This is really helpful for students because, again, students nowadays are more into instant gratification, and this satisfies that that trait that students have right now. And then endodontics and more. This cannot only be used actually for restorative dentistry. In fact, I have mentioned in the start of my lecture that there are a lot of studies wherein gamification was used more specifically for endodontics. This can actually be used in other aspects of dentistry as well. Like, for example, for instruments, you can actually use Kahoot, this one here. Okay, so for Kahoot, you can actually place an instrument and then they're going to identify, and then you're going to get a leadership board later on when you end the game, or after all of the students have answered, it's actually going to show the leadership board, and it excites the students because it brings out the competitiveness in them. Okay. And then you can also use VR, virtual reality simulators. In this case, this is for endo. They are doing virtual reality in doing access for endo. Key takeaways for today's lecture. Gamify for reasoning. So this actually gives the students a better avenue to enhance the reasoning skills when it comes to deciding on what scenario, on what choice to choose when it comes to a certain scenario. So they are really going to start thinking critically, and this is why we did the pilot study of create your own adventure games. In the future, since AI is here to stay, in the future we can foresee that AI can be integrated with create your own adventure games and making better games later on. Thank you very much. That is the end of my lecture. Again, congratulations, Cebu Doctors University College of Dentistry, for your first annual research congress. Thank you.